What causes high-functioning anxiety? Is it the same as what causes other anxiety disorders? Is it your genetics, your experiences, or a combination of both? And what can you do to treat and prevent it? In this episode, I'm going to be discussing all of these questions and more to help you understand high-functioning anxiety more so you can recognize it and ultimately learn how to overcome it. Welcome to Calmly Coping. My name is Tati, and I am a licensed therapist and a high-functioning anxiety coach. I help high achievers overcome high-functioning anxiety so they can finally stop overthinking everything. Please be sure to like, subscribe, and hit the notification bell so you can be notified when I post new videos. Thank you so much for tuning in. High-functioning anxiety is not a diagnosable mental disorder. Therefore, there is a lack of research when it comes to the specifics of high-functioning anxiety. However, this phrase has come about to describe individuals who are high-performing and high-achieving on the outside, but they struggle with anxiety from within. You might try to hide your anxiety from others, resulting in you appearing calm and confident on the outside, which might make it even more difficult for others to understand that you're actually struggling from within. You might struggle with symptoms such as worry, fear, and anxiety, irritability and frustration, an inability to relax, a need for perfectionism, overachieving, fear of failure or judgment, a desire to keep busy all the time, overthinking and overanalyzing, anticipatory anxiety, which is anxiety before events occur, elevated heart rate and faster breathing, sleep problems, changes in appetite, or digestive issues, just to name a few. The reason why high-functioning anxiety is different from an anxiety disorder is that oftentimes people with high-functioning anxiety do not meet the criteria for a mental health disorder. That's because the criteria for any mental health disorder includes that it must, quote, cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, unquote. Because individuals with high-functioning anxiety are often high performers and can do well whether it comes to socially, professionally, or in their personal lives, the anxiety can often be hidden, overlooked, or even seen as helpful. That's because your anxiety and fear can be propelling you forward into staying busy, saying yes to opportunities, and high achievement, rather than holding you back in fear and avoidance, which is often the consequence of many anxiety disorders. This is the main differentiation and reason as to why high-functioning anxiety is different from a diagnosable anxiety disorder. However, this does not mean that you do not have a mental health disorder if you identify with high-functioning anxiety. Human behavior falls on a spectrum, and depending on whether your symptoms are mild, moderate, or severe, this might impact how difficult the anxiety feels for you and how much support you might require and whether or not you require professional mental health treatment. I want to take a quick break to share my free guide. It's the Essential Guide to Overcoming High-Functioning Anxiety. In this free 5-step guide, I walk you step by step through the entire process of getting to the root of your high-functioning anxiety so you can learn how to overcome it and stop it from running your life. To get this guide, you can go to hfaguide.com. or you can click on the link in the description below if you're watching on YouTube. Now back to the episode. So now let's talk about what causes high-functioning anxiety. Many times behaviors and responses can come about because they were actually helpful at one point in your life. For example, you might have learned to avoid conflict or sharing opinionated responses because when you were a child, this might have resulted in you getting in trouble or even worse, abusive behavior. So now as an adult, this is something that you might have carried through with you, even though as an adult, it may no longer be helpful to you. The types of behaviors, thoughts, and emotions that result in high-functioning anxiety are actually helpful on the surface. Staying busy, always saying yes, and being high-achieving are often admired traits in our society. As a result, you might have learned that pushing yourself, always aiming for perfection, and trying to make the best choice possible is the way that you achieve the things you want in your life. The problem is that your underlying fear of failure and judgment may push you into overdrive and result in your avoidance of any signs of potential downfall. This combination of avoiding failure, judgment, and uncertainty, along with your learned behaviors of overworking, overperforming, and high achievement, result in the cluster of signs and symptoms called high-functioning anxiety. The problem with sustaining this combination of behaviors is that it's not sustainable. At some point, you will need to rest and recharge, and at some point, you will face failure and have to confront conflict, because that's just a part of life. Although you may have been successfully maintaining the dance of trying to keep yourself happy while keeping others happy at the same time, this is ultimately impossible to do in the long run, which then this buildup results in the anxiety and stress and overwhelm that you might be currently experiencing. And the fear of this happening is what also results in more anxiety, that fear of letting others down, the fear of failure, or the fear of letting yourself down. So now let's talk about genetics. The nature versus nurture debate is long withstanding, and I'm not here to debate whether or not it's nature or nurture that results in your high functioning anxiety, because the reality is with anything, it is a combination of both, and it is impossible to completely separate nature from nurture because they both influence and have an impact on each other. You might have inherited the genetic predisposition for worrying from your mother, and you might have also learned this by watching her behavior when you were growing up. So due to the lack of specific research on high-functioning anxiety, I'm going to refer to research on anxiety disorders and specifically generalized anxiety disorder. Family and twin studies show that genetics play a significant role in anxiety disorders. A study on the genetics of generalized anxiety disorder found that, quote, it is a heritable condition with a moderate genetic risk, with a heritability of approximately 30%, unquote. This means that there is a 30% chance that you may have inherited the gene or the genetic predisposition for anxiety from your parents. So this means that you may be more likely to struggle with anxiety if a blood relative of yours also struggles with anxiety. So many studies support the diathesis stress model in psychology, and bear with me because I know I'm using a lot of big terms, but this suggests that mental health struggles stem from having a genetic predisposition, which I just talked about. So having a gene that was passed down to you that makes you more likely to have anxiety, and along with a significant life stressor. So this could be experiencing trauma or anything significantly stressful in your life that can trigger anxiety. Examples could include trauma, the death of a loved one, increased work stress, chronic stress or financial stress, relationship stress, or more. So when you have the genetic predisposition, meaning that you've inherited the likelihood to get anxiety from a parent, this can mean that you're more predisposed to get it. And then when you experience a life stressor, this can trigger anxiety for you. Again, this is not a perfect science, and there can be many factors that come into play when it comes to anxiety, such as medications that you're taking, drugs or alcohol that you're taking, other physical health conditions that can also have an impact on anxiety. So just keep that in mind as well. What is the best treatment for high-functioning anxiety? So the best treatment for high-functioning anxiety can vary from person to person, and it will ultimately depend upon how significant your symptoms are and how well you are functioning in your day-to-day life. Therapy can help you learn ways to positively cope with your emotions, manage anxiety, have a supportive outlet to talk to, and work through past trauma or past difficulty and current life stressors that you're experiencing. Medication can help you to decrease symptoms of anxiety and improve mood depending on the type of medication. If you're struggling with an anxiety disorder, medication can help you to manage the symptoms, while therapy helps you to learn the long-term skills and knowledge to cope with and prevent future anxiety. And coaching is a great option for individuals who do not meet the criteria for an anxiety disorder, or they're currently in therapy and want an added support of coaching to provide them with the accountability, education, and support that they need to reach their goals. Working with a high-functioning anxiety coach can help you learn ways to increase calm, focus, and productivity in your life while maximizing your full potential. And this is a great option for high-achieving individuals who are otherwise functioning well, but they find that their fear and anxiety is getting in the way from them achieving the goals and the true potential that they feel they fully have. If you're interested in learning more about coaching, then you can click on the link in the description to learn more about my coaching and course offerings for high-functioning anxiety. In regards to specific tools and intervention, what I have found works best with regards to both my coaching and my therapy clients are a combination of mindfulness, cognitive psychology, which is recognizing and challenging your negative beliefs and ways of thinking, energy management by setting boundaries and learning how to say no, and respecting your natural human need to rest and recharge, and self-compassion, which is the practice of being kind to yourself and challenging that inner critic that comes up and makes you put so much pressure on yourself. Ultimately, the tools and interventions may vary from person to person and to what your personal needs and preferences are. So how can you prevent high-functioning anxiety? Awareness is the biggest and most important step to help you prevent high-functioning anxiety. That's because you can catch yourself in the thoughts, emotions, and behaviors that lead you to those cycles of overworking, overthinking, overanalyzing things, and self-doubt, and stop it before things get worse. Awareness is the first step to changing your behavior and making long-term changes in your life. Mindfulness is a great way to practice becoming more aware and also to help you identify what your personal warning signs are for the signs of high-functioning anxiety in your behaviors, thoughts, and emotions. And that is a great place to start, is identifying what are those warning signs for you that you notice that things are getting more difficult and that you notice things are getting worse. What are the changes in how you're thinking about things, in how you are feeling and what your emotions are, and in your behaviors and what you're doing and what urges you're having when it comes to your behaviors. Maybe you notice more urges to always be busy or to binge watch TV shows or to distract yourself by going on your phone when things are getting more difficult. Recognize what your personal warning signs are so you can be aware of them, notice when they come up. Don't be hard on yourself, be kind to yourself, and then stop it before things get worse. There is nothing wrong with you for struggling with high-functioning anxiety, and the fact that you are seeking out information and support is amazing. It means that you are committed to taking care of your mental health, and the first step to making any positive changes is having that understanding and awareness of what is personally going on for you. Your action step for this episode is to become more aware of yourself from a non-judgmental and curious perspective. When do you catch yourself in that place of always needing to be busy? What behaviors might you have learned from your past that resulted in the way that you approach situations today? I'd love to hear your thoughts on high-functioning anxiety and how it has affected you personally. So leave me a comment below letting me know your thoughts. You can also share your thoughts in my free Facebook community for high achievers with high-functioning anxiety, calmly coping. You can find it by clicking on the link below or by going to calmlycoping.com/group. While you wait for next week's episode, I have other episodes about decreasing anxiety, adopting a healthy mindset, and managing your time and energy. So make sure you check out these videos here. Thanks so much for tuning in, and until next time, be calm.